Welcome to the deep dive. Today, we're getting into something pretty specific but really fascinating. It's about newborn horses. It might sound a bit niche, but trust me, this deep dive really unpacks some critical stuff about vulnerability, how important prevention is, and, well, just how fast medical help is sometimes needed. We've got some detailed sources here on something called foal navel ill.
Yeah.
So yeah, we're talking about baby horses' foals. And this particular problem is a bacterial infection right there in the leftover bits of the umbilical cord. The technical name is Omphalophlebitis. Our mission today really is to get why this is such a big deal, how quickly things can go wrong, and maybe what we can all learn about that super critical time right after birth, for any newborn. So let's get into it.
What is navel ill? Understanding the basics.
Okay, so navel ill. The name sounds pretty straightforward, but medically speaking, what exactly are we dealing with here?
Yeah, and what's interesting there is the language. Navel ill is the common term, sure. But technically, we often talk about omphalophlebitis. That specifically refers to an infection of the umbilical vein.
Ah, okay.
But there's a broader term, too, omphalitis, which covers an infection in any part of those umbilical structures.
And what are those structures exactly?
Well, you've got the umbilical vein, which carried oxygenated blood from the placenta, two umbilical arteries, which carried waste away, and the urachus.
The urachus.
Yeah, that's the tube that connects the foal's bladder up to the umbilicus before birth. It lets urine pass out into the placental fluids, and actually the urachus is the structure that gets infected most often.
Wow, okay. And these aren't just like skin issues, are they? These things are hooked right into the foal's internal systems.
Exactly. They're direct lines in.
So that brings up a key question. What's supposed to happen with the umbilical cord after birth? Like, what's the normal timeline, and when does it signal a problem?
Right. So ideally, a normal umbilical stump, it shouldn't be open or patent beyond about 24 hours.
Yeah.
It should then start to dry out, shrivel up. The term is involute, usually by day 3 to 7. And, by 3 or 4 weeks old, it should pretty much be gone, just a normal belly button.
Okay, so if it stays wet or open longer than that, that's definitely a warning sign. What kinds of bacteria are usually involved when things go wrong?
It's often the usual suspects we see in neonatal sepsis, serious infections in newborns. Things like E. coli are very common. Certain types of streptococcus, staphylococcus, Klebsiella, bacteria that are pretty common in the environment, unfortunately.
And which foals are most at risk here?
Typically, it's the very young ones. Neonatal foals, often just days old. That's the most common time frame.
Yeah.
But, and this might be a bit surprising, these umbilical abscesses, these pockets of infection, they have actually been found in older foals, even up to like 16 months old.
Really? 16 months?
Yeah, though it's much less common. And as far as we know, there's no specific breed or sex that's more prone to it.
The why, causes and risk factors.
Understanding why this happens, that seems crucial if you want to prevent it. What really sets the stage for an infection like navel ill?
Well, fundamentally, it comes down to bacteria getting into places they shouldn't be. There are really two main ways this happens. One is bacteria basically crawling up from the outside through those open umbilical structures. We call that ascending invasion. The other way is if the foal is already septicemic, meaning it has bacteria circulating in its bloodstream from somewhere else.
Sure.
Those bacteria can then seed or settle in the umbilical structures. That's hematogenous seeding.
Okay, ascending or through the blood. And what about the foal's surroundings? What are the biggest environmental factors?
Oh, the environment is huge. Probably the most common issue is just an unsanitary place for the foal to be born and live in those first few days. So dirty stalls, muddy pastures, anywhere with a high bacterial load just drastically increases the risk.
Makes sense.
And alongside that is poor or improper disinfection of the umbilical stump right after birth, or maybe not doing it at all.
Because it's literally an open door.
It really is. For those first few days, it's a direct pathway into the foal's body. Needs to be managed carefully.
Now, something that really jumped out from the sources, and this feels critical for understanding any newborn's vulnerability, is this thing called failure of passive transfer, FPT. What exactly is that?
Ah, FPT. Yes, this is absolutely critical. See, foals are born basically with no immune system to speak of, no antibodies. They get all their initial protection by drinking the mare's first milk, the colostrum, which is packed with antibodies, specifically IgG.
Right.
And they have to absorb these antibodies through their gut wall within the first, say, 12 to 24 hours. That window closes fast.
So if they don't drink enough or don't absorb it properly?
Then they have failure of passive transfer. Their immune system doesn't get that essential kickstart. They are profoundly immunocompromised,
Wow.
which makes them incredibly susceptible to any infection going around, and navel ill is definitely high on that list. It also ramps up the risk for really serious complications like septic arthritis infections spreading to the joints.
Septic arthritis. Okay.
Yeah.
So there's like a level they check for?
Yeah, we measure the IgG level in the foal's blood. Generally, a level below 800 milligrams per deciliter is considered a significant risk factor for FPT and associated problems.
So it's like their immune system needs this massive, immediate download of protection, or they're just left completely exposed.
That's a good way to put it, yeah.
And are some foals just naturally more vulnerable besides the FPT issue?
Absolutely. Any foal that's weak, maybe born premature or dysmature, meaning they didn't develop quite right despite being full term, or sometimes we see dummy foals, those with neonatal maladjustment syndrome, they just aren't as vigorous.
So they might not get up and nurse right away.
Exactly. They might lie in contaminated bedding for longer, they might not nurse effectively to get that colostrum, and their own immune systems are often immature on top of that. It all adds up.
You mentioned the urachus earlier, that tube from the bladder. How does that play into causing infections?
Right, a patent urachus, that's a big one. Patent just means it stays open when it should have closed. So if that tube connecting the bladder to the navel doesn't seal off after birth, urine can actually leak out through the umbilicus.
Urine leaking from the belly button.
Yeah. And that constant moisture, first, it irritates the skin, but more importantly, it creates this perfect, warm, wet environment for bacteria to absolutely thrive. Plus, it's a direct pathway for infection to travel up into the bladder and then potentially into the other internal umbilical structures. It can be something they're born with, or it can actually develop because of an infection.
Okay, that makes sense. Are there any other risk factors we should know about?
One other thing is trauma, being too rough when handling the umbilical cord, or maybe using disinfectants that are too strong, too caustic. That can damage the delicate tissues around the navel and basically create an entry point for bacteria as well. So gentle but thorough care is key.
The how. Diagnosis of navel ill.
Okay, so knowing how serious this can get and how fast, catching it early seems absolutely vital. How do vets figure out if a foal has navel ill? What are the first signs you might see?
Well, the clinical signs can really vary. It depends quite a bit on whether the infection is just stuck right there at the navel localized, or if it's managed to spread systemically through the whole body. And these signs can pop up anywhere from just a few days after birth up to several weeks, commonly maybe between 1 week and 2 months old.
So focusing on that localized infection first, if you're checking a foal, what specifically should you be looking for right around the belly button area?
Okay, for localized omphalitis, you might notice swelling. The umbilical stump itself, or the area right around it, might look puffy or enlarged. It could feel unusually firm, maybe hard, and it's often painful if you gently press on it.
So the foal might react.
Yeah, they might flinch or resent being touched there. The area could also feel warmer than the surrounding skin. You might see discharge, sometimes thick, pus-like, purulent discharge. And if that patent urachus is involved, like we talked about, you might actually see urine dribbling from the navel.
Right.
In cases that have been going on a bit longer, maybe more chronic, you might even see some swelling spreading under the belly that's ventral edema. Careful feeling, palpation, might reveal thickened internal cords too.
And if it has spread systemically, that sounds much more alarming.
It is, yes.
Yes.
Much more serious. If the infection gets beyond the navel, you'll start seeing signs that the foal is sick overall. A fever is common, usually defined as a temperature over about 102 Fahrenheit or 38.9 Celsius.
Okay.
The foal might just seem off, lethargic, depressed, dull, weak. Maybe they don't want to suckle properly, or they stop eating altogether, which is anorexia.
And you mentioned complications before. What's the really common concerning one with systemic spread?
What the sources really highlight and what we see clinically is lameness and joint swelling. That's a huge red flag.
Ah, the septic arthritis again.
Exactly. Seeing swollen joints that feel hot and painful, often the hocks, the stifles, the knees, are common sights that is very frequently linked back to an initial navel infection that spread. It's a true medical emergency.
Wow.
Other signs can include things like diarrhea, maybe signs of colic or abdominal pain, respiratory issues like rapid breathing or a cough suggesting pneumonia, and just general signs of sepsis like bright red gums, slow capillary refill time when you press on the gums, or a racing heart rate.
And the takeaway is, if you see any of those systemic signs, you absolutely have to check the navel carefully, right?
Always. Always examine the umbilicus thoroughly if a foal shows any signs of systemic illness or lameness.
So beyond just looking and feeling, what are the main diagnostic tools vets use to confirm this?
While that careful physical exam, the palpation, is important, feeling those structures. But really, the gold standard for diagnosing navel ill is diagnostic ultrasound.
Ultrasound. Okay, what does that actually show the vet?
It's fantastic because it lets us see inside, visualize those internal structures, the umbilical vein, the arteries, the urachus. We can measure their diameter. There are normal size ranges, like the umbilical vein should be less than a centimeter across, the arteries less than about 1.3 centimeters. We can see if they're enlarged.
Okay.
We can also see if the vessel walls look thickened, if there's fluid or pus, or even gas pockets within them. We can spot abscess formation, and crucially, ultrasound can tell us definitively if the urachus is patent, if it's still open. It can even show if the infection is starting to creep up towards the liver or into the bladder wall. It's a really detailed picture.
That's pretty amazing detail. What about blood tests? What role do they play?
Blood tests are really important too. A CBC, complete blood count, often gives us clues. We might see a high white blood cell count that's leukocytosis indicating infection. Or sometimes we see an increase in immature white cells called a left shift, which means the bone marrow is working overtime to fight something off. We might also see changes in how the white cells look, called toxic change.
Signs of inflammation, basically.
Exactly.
Yeah.
And we also look at things called acute phase proteins, fibrinogen, and especially serum amyloid A, or SAA. These go up really quickly with inflammation and infection. They're not only good for diagnosis, but also really helpful for tracking whether the treatment is working. You want to see those numbers come down.
Makes sense.
And critically, we check that serum IgG level. We need to know if failure of passive transfer is part of the picture, because that dramatically increases the risk of sepsis.
Right, the FPT.
If we do suspect sepsis, taking blood cultures is essential. We try to grow the bacteria from the blood to identify exactly what it is, and importantly, which antibiotics will kill it. That guides treatment. Oh, and if the urachus seems involved, a urine sample, urinalysis, might show white blood cells or bacteria there too.
And if a foal does have swollen joints, what's the diagnostic step there?
If there's joint swelling, you absolutely have to get a sample of the fluid from inside that joint. It's called arthrocentesis. We analyze that joint fluid, looking for a very high white blood cell count, and we culture it, again, trying to grow the specific bacteria causing the septic arthritis. That confirmation is crucial.
Okay. Any other diagnostics sometimes used?
Sometimes abdominal x-rays might be used, maybe to look for tears in the urachus if urine is suspected in the abdomen, or chest x-rays if pneumonia is suspected, or x-rays of bones if we're worried about infection in the growth plates, which is called fasciitis.
Got it. And the sources also mention making sure it is navel ill and not something else that might look similar, differential diagnoses.
Yes, that's important. You need to differentiate it from, say, just a simple patent urachus that isn't infected yet, although that's still a risk factor.
Or like a hernia.
Exactly. Or an uncomplicated umbilical hernia, which is a bulge where the abdominal wall didn't close properly. A simple hernia shouldn't be hot, painful, have drainage, or involve enlargement of those internal structures. And crucially, a simple hernia or patent urachus wouldn't typically cause systemic signs like fever or lethargy. The history, the physical exam, and especially that ultrasound really helps sort these things out.
Treatment and prevention. What happens next?
Okay, so once navel ill is diagnosed, the sources make it really clear that treatment needs to be pretty immediate and often quite aggressive. What does that usually look like?
Yeah, treatment is definitely not something to delay. It often involves a combination of both medical management and sometimes surgery. The first step almost always is starting broad-spectrum antibiotics, and usually intravenously for maximum effect.
Broad spectrum meaning they cover a wide range of bacteria.
Exactly, because you need to hit the infection hard and fast even before you know exactly which bug you're dealing with. Common choices might be something like penicillin combined with an aminoglycoside like amikacin, or maybe a cephalosporin antibiotic.
And you start those right away.
Pretty much immediately, yes. Then, once those culture and sensitivity results come back from the lab, maybe from blood or joint fluid, the antibiotic choice can be refined. We switch to the drug that's specifically known to be effective against that particular bacteria.
Makes sense. And is it a short course of antibiotics?
Oh, definitely not. Treatment is typically long-term. We're often talking 2 to 4 weeks, sometimes even longer, depending on the severity and how the foal responds. You need to continue well past the resolution of clinical signs.
Wow, okay. And what about managing the pain and inflammation that comes with it?
Yes, pain management is important too. NSAIDs, non-steroidal anti-inflammatory drugs like flunixin or ketoprofen are commonly used. They help with the fever, the pain, and the swelling.
Are there any concerns using those in foals?
There are, yeah. You have to be cautious, especially in very young foals or if they're dehydrated, because NSAIDs can potentially affect kidney function. Sometimes gastroprotectants, like stomach protectors, are given alongside if the NSAIDs are used for a while. And the aminoglycoside antibiotics also need careful monitoring regarding kidney function.
Okay, so antibiotics, pain relief. When does surgery come into the picture?
Surgery, specifically surgical excision of the umbilical remnants, is often considered the definitive treatment, the best way to fully resolve the issue in many cases.
When is it most needed?
It's particularly indicated if the infection clearly involves those internal structures, the vein, arteries, urachus, especially if ultrasound shows significant enlargement or abscess formation. Also, if the infection seems to be extending up towards the liver, or if there's a persistent patent urachus that just isn't closing despite medical treatment, or, frankly, if the foal just isn't getting better with antibiotics alone.
And what does the surgery involve?
Essentially, the surgeon goes in and carefully removes the infected portions, the affected part of the umbilical vein, the arteries, and the urachus, right back to healthy tissue. Sometimes, if complete removal isn't possible, a procedure called marsupialization might be done, creating an opening to allow drainage.
Right. Beyond the specific treatments like antibiotics and surgery, what about just general supportive care for these sick little guys?
Oh, supportive care is absolutely crucial. It can make all the difference. This includes things like IV fluids if the foal is dehydrated or septic to maintain hydration and circulation. Nutritional support is vital too. If they're not nursing well, they might need milk fed via a bottle or even a nasogastric tube. Sometimes ID dextrose is needed if their blood sugar is low.
And what about that FPT, the failure of passive transfer, if that was diagnosed?
Good point. If FPT was confirmed, especially if the IgG level is very low, like below 400 milli-GDL,
Yep.
then giving an intravenous transfusion of hyperimmune plasma is really important. This directly gives the foal antibodies to help fight the infection. And of course, aggressively treating any complications is key. If there's septic arthritis, that often requires flushing the joint out, joint lavage, and sometimes injecting antibiotics directly into the joint. Pneumonia needs appropriate treatment too.
And just basic nursing care?
Absolutely paramount. Keeping the foal in a clean, dry, warm environment. Minimizing stress. Closely monitoring their vital signs, temperature, heart rate, breathing rate, as well as their attitude, how well they're nursing. And keeping an eye on the umbilical site itself. Regular rechecks of blood work like the CBC and SAA levels and repeat ultrasounds of the umbilicus are essential to track how things are progressing and adjust treatment as needed.
So putting it all together, what's the general outlook, the prognosis?
It really varies. For foals where the infection is small and just localized to the external stump, they often respond quite well to medical treatment alone. The prognosis there is generally good.
But if it's more extensive?
If the infection involves those deeper structures, the internal remnants, surgical removal seems to significantly improve survival rates, probably because it removes that persistent source of infection and reduces the chance of it spreading elsewhere later.
And the joints.
Unfortunately, the presence of infected joints, septic arthritis, definitely makes the prognosis worse. It's a serious complication that can have long-term consequences even if the foal survives.
What are some of the potential complications overall?
Well, sepsis itself, the bloodstream infection, is primary. Septic arthritis is probably the most common serious sequela, but you can also see infection spread to the growth plates of bones, septic fasciitis, or the bone itself, osteomyelitis. Pneumonia can develop. If the urachus is infected, it can sometimes necrose or die off and potentially rupture, leading to urine leaking into the abdomen, which is called uroabdomen, or under the skin. Infection can also track up the vein to the liver, causing liver abscesses. Lots of potential badness.
It really highlights why prevention is so critical. Thankfully, the sources give some really clear steps for that. So what can people actually do to prevent navel ill?
Yes, prevention is absolutely where the focus should be, and it really comes down to good management practices right around the time of foaling. First off, the foaling environment needs to be hygienic, as clean and dry as possible. That means a thoroughly cleaned and disinfected stall bedded with fresh straw, or foaling out on a clean, dry pasture area, not a muddy paddock.
Okay, clean environment. What else?
Second, and this is super important, proper umbilical cord care. The recommendation is to let the cord break naturally. When the mare or foal stands up, don't cut it unless absolutely necessary. Then, immediately after it breaks, you need to dip the remaining umbilical stump in a suitable antiseptic solution.
Dip it. How does that work?
You get a small, clean cup, like a shot glass or film canister works well. Fill it with the dilute antiseptic. The commonly recommended options are either a 0.5% chlorhexidine solution.
How do you make that?
You'd typically dilute a 2% chlorhexidine solution, maybe 1 part chlorhexidine to 3 parts clean water. Or alternatively, a 1% or 2% iodine solution can be used, though some worry it might be slightly more irritating.
Okay, chlorhexidine or iodine. Then what?
Then you carefully place the cup over the entire stump, pressing it firmly against the foal's belly so the stump is completely submerged in the solution. Hold it there for a few seconds.
Just once.
No, this dipping should be repeated usually 2 or 3 times a day for the first 2 to 3 days of the foal's life, or at least until the stump is clearly dry and starting to shrivel up. This simple step provides a crucial chemical barrier against those ascending bacteria.
Okay, that seems very doable and very important. What's the third key thing?
Third, and this loops back to our earlier discussion, is ensuring adequate passive transfer of antibodies. You need to make sure that foal gets enough good quality colostrum quickly.
How quickly?
Ideally, they should be up and nursing strongly within 2 to 4 hours of birth. They need to drink a good amount, maybe 1 to 2 liters total, within those first 6 to 12 hours to absorb enough IgG. Checking the mare's colostrum quality beforehand can be helpful too.
And checking the foal.
Yes, testing the foal's IgG level in their blood at around 12 to 24 hours old is highly recommended. If FPT is diagnosed again, usually less than 400 or definitely less than 800 milli-GDL, depending on the threshold used, then giving intravenous hyperimmune plasma is the way to correct it. Don't wait.
Okay, clean environment, dip the navel, ensure colostrum. Anything else?
Just close observation. Really monitor the foal closely for those first few wints. Watch their activity level, how eagerly they nurse, their overall attitude. And pay particular attention to that umbilical area. Check it daily for any signs of eat, swelling, pain, moisture, or discharge. And if you see anything concerning any swelling, any lameness, the foal seems dull, get veterinary attention immediately. Prompt action makes a huge difference. Outro.
Wow. Okay, that was definitely a deep dive into foal navel ill. We've gone from these tiny little structures inside a newborn foal all the way to major surgery and these really vital preventative steps. What really strikes me, listening to all this, is that connection between something seemingly small, like just an umbilical cord that hasn't closed properly, and how rapidly it can escalate into a massive life-threatening systemic problem. And then the flip side, how a relatively simple action like dipping that navel correctly with the right solution can be so incredibly protective. That window of vulnerability right after birth is just, it's so critical.
It really is. And if you zoom out a bit, think about the bigger picture. It just underscores how vulnerable all newborns are, really, not just foals. That immediate care right after birth, making sure they get that passive immunity, whether it's colostrum or something else, depending on the...
So what does this all mean for you listening? Well, even if you're never going to be near a newborn foal, hopefully this deep dive serves as a kind of powerful reminder, a reminder about that really delicate balance of health in the very beginning of life, and just how much value there is in being proactive, being informed, and taking those preventative steps seriously, especially when caring for the very young and vulnerable. We hope you picked up some surprising facts, maybe some valuable insights today. Keep looking for those aha moments in whatever you're learning about. Thanks for joining us for this deep dive.